Hello, my name is Brett Simpson. I'm here at Appalachian Outdoors doing the free university talk, and I'm an instructor for the Wilderness Medicine Institute of NOLS, and I'm here just talking about wilderness medicine and trying to encourage people to take a wilderness medicine course. Has an accident in front of you. There's a patient there. What's the first thing you want to do?
Make sure the scene is safe.
Make sure the scene is safe. Excellent. So poor Brad has some type of head wound. How could he have gotten this head wound in the backcountry? So I mentioned my kayaking accident, trying to go face first into a rock.
Rock fall.
Yeah, rock fall. We saw something like this not too long ago, of course, a bareback, right? Trying to either chuck the rock over. We had actually a branch. It looked like a more healthy branch than it was. Came down, hit them in the head like that. Person laying on the ground saying, "This feels just like when I broke my back 5 years ago." Right. So this is kind of the situation that we could run into. So I'm going to do kind of a hybrid with my assistant here. You're practicing? You're watching ER or anything? Okay. Hopefully we can help Brad. I'm going to kind of do a little bit of demo of how we might approach the scene. This is something we call our patient assessment system, and Faith's going to be actually holding his head to stabilize, which is pretty cool because she totally could if we spent the time to show her how to do it. I might pause a little bit just to explain. So I'll at least mention the scene safety thing. We do this little thing where we think finger number one, I'm number one, and I want to make sure nothing's going to fall, like lights aren't going to explode, lightning. The bear's still not attacking him. There's no other branches coming down. He's already taken out the one rock, so that's okay. Finger number two is what happened to you, so we try and get an idea of like, maybe here I saw it, maybe he's wearing the really cool Lycra tights and he's got a chalk bag and tight shoes and we see the boulder, so we think maybe he fell off a rock, something like that. Maybe someone tells us, they come running up, like my friend Herb. I was at the Gunks one time and off to the side I heard this. It's like, okay, I'm pretty sure someone just fell over there. So, right, we can, sometimes these environmental clues tell us. Finger number three, don't get any on me. Luckily, Faith and I, when we go hiking, we just always wear gloves, which works out pretty good. But we can think about our Gore-Tex jacket on, some sunglasses to protect our eyes if we can see some blood. Finger number four is how many more. So this is all stuff I'm doing from a distance, so I make sure I'm not injured. And this is looking at, is there any other patients? Because poor Brad is screaming in pain, but his friend, poor Sally, is really injured, and we don't hear her. So we just want to see if we see anyone else, because they might be a higher priority. And then finger number five, this is thumbs up, thumbs down. So we say dead or alive, finger number five. So how sick do you think he is? So this is not sick, this is really sick. Where do you think he's at, just looking at him?
Can I do that?
Sure. Sounds good. What this is kind of doing a couple things. What I'm trying to do is starting to psych myself up a little bit, so if I go in there, because right, if I see blood and I'm worried about this and I come in, I'm like, Brad, I'm ready to help you, I'm your rescuer, and I'm like, blood! Right? Now I have another patient, I hit my head, like this isn't going to help. Maybe I want to get materials ready. I need to make sure I'm psychologically ready to come into this scene, and that I kind of get an idea of what I'm going to approach in here. Is he really injured? Is he faking it? What's the case? Okay, so just follow me, Faith. Hey there, sir. I'm Brett. This is Faith. We're medically trained. Can we help you out? Excellent. So go ahead and just keep your head still for me. Faith, come around here. What I want you to do, go like this with your hands. And now put that hand around the ear on this side. Put that hand around the ear on this side. Excellent. You're going to keep his head just still like that. That's going to be your job, keeping his head still, okay? Excellent. Go ahead and open your mouth for me. Anything inside of there? Nothing? Take a deep breath for me. Do you feel like you're bleeding anywhere? Okay. Good pulse going on. Let's just check. Sure, I don't see any blood in there. What happened? How'd you end up lying here with this big bruise on your head?
I fell off the rock.
How far do you think you fell?
I don't remember.
Like 45 feet? That sucks. That's a long ways. We're going to actually keep holding your head. I worry about a spine injury for you. I'm going to go ahead and keep holding your head, or Faith is for now. Just we're going to get some more information first, okay?
Sure.
How are you doing here on the ground? You hot, cold, Comfortable enough for now?
I'm good.
You're good for now?
Yep.
Okay. Do you feel like you hurt anywhere else besides your head?
No.
Okay. I'm just going to check that out a little bit in here. So let's see too much. All right. We're just going to check out the rest of you real quick here. Make sure. You open your mouth one more time for me. Grit down on your teeth for me. Great. Close your eyes. Open your eyes for me. Great. Thank you. Do you wear a med alert tag?
No.
Anything like that? Great. Any pain at all when I do this?
No.
Shoulders feel okay?
Yep.
Okay. Take a deep breath for me. Any pain at all?
No.
One more deep breath. Great. And one more for me. That all feels okay? Can you point to your belly button for me? Okay. Great. Any pain at all in their abdomen? Hips feel okay?
Yep.
There's this question we now ask in our course that we call the dreaded genital question, which is, did you hit your genitals when you fell?
No. No, I didn't.
During the course, we want no. For someone who's had a high-speed mountain biking accident, it definitely can be a yes in there. So hopefully not that you have to do those. So we're just going to keep. What I'm trying to do is just make sure there's nothing else that I'm missing because he's focused here on this pain. This legs feel okay?
Yes.
Any hot, cold, numbness, tingling in your feet?
No.
Feels okay? Can you feel which toe I'm grabbing?
Big toe.
Okay, which foot?
Right foot.
Okay, how about now?
Big toe left foot.
Okay, can you push down on the gas pedals, push down on my hands for me, pull up on my hands? Okay, great, let's just check. Any pain in your arms at all?
No.
Feels okay, that's good. Pulses, which finger am I grabbing?
Index finger.
Which hand?
Left hand.
Great, and how about now?
Same finger, right hand.
Okay, great, and squeeze my hands for me. That all feels okay? Okay, pause 1 second. Next test, there's something I've not checked on my poor patient here. What haven't I checked?
Pulse.
Check pulses. No, something else on his body, I'll ask. The back. These are great for glove boxes in here. And so I'm going to need to roll my patient to check his back. While I roll him, I'm going to go ahead and put him on a pad just if I can. All right, so Faith, what I want you to do, come up on your knees just a little bit.
You just happen to have that pad with you?
Just happen to have it with me.
Okay.
It could be something else, but I'm going to think about insulating from the ground. By nature of some of my medical training, I definitely carry different stuff with me, and depending on my environment, especially if I'm trip leading. Okay, so Faith, what's going to happen? See this gap on his head here? So as we're going to roll him towards me, and what I want you to do is just keep his head right in line with me. So as he comes up, his head's just going to go like this.
So same, like he's a toy or something?
Yeah, we're going to kind of roll him this way, and you're going to just try and keep his head exactly like that in relation to his body. If I was really doing this, I might even practice on someone else, but this might be my resource to use. So my patient's a resource. In the backcountry, we don't have resources, so we're going to try and maximize everything we have. All right, so let's roll it over. Or that stiff as a board, light as a feather kind of game as a kid. That's going to be just nice and tight on your body. And then Faith, you're going to count to 3, and we're going to roll towards me. Nice, Faith. Keep good hold of that head. That was awesome. Much better than that. Of course, the first one. And so I want to just check down his spine. So you'll feel me pushing in here on your spine. No pain at all.
No.
Okay. Am I still on your spine here?
There you go.
Okay. Any other pain back here?
Nope.
Really? Okay. Pain on the pad. On your count of 3, we'll go back down.
1, 2, 3.
Great. Besides your head, do you feel any dizzy, nauseous, anything else going on?
Dizzy.
A little dizzy, any headache, anything else? Anything else, belly? Are you allergic to anything?
Not that I'm aware of.
This isn't med alert related. Okay. Any medications you're on?
None.
Okay. Any multivitamins, ibuprofen, anything else?
Multivitamin.
Okay, just one today.
Yeah.
Do you know the brand?
No.
Okay. You've been taking them for a while?
Yeah.
Okay. Any other medical things I should be aware of? Any disease, diabetes, any other things, seizures, anything else that might affect you while you're here? Otherwise, you're pretty healthy. This is happening. What's the last thing you had to eat and drink?
Cliff Bar and water.
And water? Okay, like together you blended them?
Yes.
Okay. Been going to the bathroom regularly? Seems okay for you?
Yes.
Okay, great. Tell me how you ended up lying here on the ground.
I fell off the rock face.
Okay, what happened? Did you black out when that happened?
I don't know. I remember waking up on the ground.
Okay, just remember waking up on the ground here. Okay. I'll pause here. What I would do now is I get some heart rate, respiratory rate, skin color, temperature, and moisture, and his level of responsiveness. Right now he's awake and oriented, which is a good sign for here. So this gives me some baseline kind of vital signs. That's all.
Are these vitals for you, or are they for the ultimate rescuers to tell them what's going on?
Good question. So they're vital because they're what's affecting your patient. What I'm going to try and do is get multiple sets, and so I can start to compare. Am I going to have this trend? And is what I'm doing helping him, or am I not helping him, or is he deteriorating because of his condition? So I now need to go from a like, hey, maybe we'll casually get him out, to let's get a helicopter.